Paolo, I just wanted to explore, in your experience with Ring 20 epilepsy syndrome, some of the characteristics that you've come across that are very specific to Ring 20 syndrome.
There are different characteristics depending on upon the age when you see for the first time the child or the teenager. But one of the most important things to me is to recognize early this kind of epilepsy in children when they start with very frequent seizures, because this can be the key to recognize the epileptic encephalopathy that we think that if it's stopped early can avoid a further deterioration in the children, because these many seizures and this electrical activity that is going on during the day, during the night, is very disturbing for the child, and the child can lose some of the skills that acquired before. And if we find a way with drugs, we are not that good in doing that all the time, but if we can stop that, I'm sure that the prognosis of the disease would be much better.
So if we see that in most cases seizures don't develop to the age of 4, in your experience, what sort of ages are you seeing Ring 20 manifest in terms of epilepsy?
I've seen teenagers manifesting with Ring 20, even that didn't have any symptoms before. They were perfectly normal, and they started to have very long seizures and non-convulsive status as the first manifestation. So one key out of the children age is are seizures that are lasting longer than usual, because probably one of the mechanisms that is not working in Ring 20 syndrome is the mechanism that stops seizures. Seizures usually last few seconds, minutes, and here lasts very much longer. Even tonic-clonic seizures is longer than usual.
So the length of seizures that you see
that can be a clue.
Can be a clue. Is there anything else in terms of clues that you would look in terms of differential diagnosis for, if someone you were suspecting that maybe?
The EEG, electroencephalogram, is
EEG.
very important, because if you look at the electroencephalogram, you can have really the suspect of the syndrome. And as you know, if you don't do a karyotype, that is an older type of exam that we don't ask that often, and we are not going to ask in a child or in an adolescent that is normal, without intellectual disability, without dysmorphic features. But we have to suspect the syndrome and to ask for the karyotype, an older type of genetic exam that is the only informative exam for the diagnosis here, for the definite diagnosis.
So definite, and the diagnosis, you're really looking for that karyotype, which is an older type of observation. So through the microscope you can see the ring clearly,
and sometimes you need to count more cells, more mitosis than usual, because it's ring chromosome 20 is often a mosaic, so you need to count many more mitosis to make the diagnosis.
So looking for more than 30 cells?
Yes, usually we ask for to count 100 cells.
Up to 100 cells?
Yes.
So this is very useful and very important.
Yes.
So Professor Paolo Canevini, thank you so much for joining us at the conference. We look forward to hearing more from you in terms of research going on into the future. Thank you so much.
Thank you for your invitation.